What it is called Texas Care. They're based out of Houston. They are opening up mental health care clinics across Texas right now. So Texas, 3 out of 8 kids are on Medicaid. 98% of the counties in Texas are deemed mental health care crisis. Like the whole country is probably a mental health care crisis, really. But in Texas, there's a code that they go into with these kids. It's like a preventative big brother, big sister program for kids. They go hang out with these kids in the communities for 2 to 5 hours a week. They're with them, hanging out. It's not like you're sitting on a couch, going into an office, talking like an hour, every week or two or a month. They're hanging out with them. They're getting billed $102 an hour while they're hanging out with them. We pay our social workers $30 an hour, which is above, like probably $5 above the going rate in Texas. And so there's a $70 spread on every billable hour. And you're meeting kids 2 to 5 hours a week for years. They stay with you. So there's a really big opportunity there for, like, the value of every kid is pretty big. What Texas Care does, they're opening up these franchises. To give you an idea, they went into 2 school districts. They were handed a box of over 2,000 kids' names, papers. There's a video on our landing page about it. They're on a waiting list right now. There's people that 6 to 12-month waiting period just to get assessed to go into these programs. And when you have a mental health issue, like, it's not like it's, I could see you 6 months from now. It's like you need something today. So they're trying to work on shortening that time frame down. Texas Care's goal is when you franchise, you come in at $65K. That would be you owning the franchise. They hire all your social workers for you. They train them. They provide in the beginning the licensed practitioner, all that. Their goal is to have you have 30 kids on the day you open. And how easy is that? They've a lot of times they'll go into apartment buildings with some pizzas and educate the family on a program they didn't even know existed that's free to them for their kids to come in. In Fort Worth, they went into 2 apartment buildings. They had like 40 kids signed up after like a few hours in 2 apartment buildings. So really easy to get the kids. There's people on waiting lists. There's a huge need for this. If you were to have 30 kids and that's all you ever had in your clinic, that equates to about 500 grand in gross revenue. And because the expenses are so low on this, the net is like 2 to 250. The reason the price is so low right now is it's kind of a proof of concept on doing it as a franchise, like in this model of growing it. They've had their corporate for years. They see the numbers, it's there. They're showing that how they can do this on scale. They're building up a whole corporate team. It's really awesome. Like, if you guys do go down this path, I would definitely suggest getting down to Houston and visiting, go and see corporate and all that. But the thing with these offices too, like, they don't stop at 30 kids. You could have 60 kids, 90 kids, 120 kids. If you do the clinic, like, it's your franchise. So they take 13% of gross for royalties. And in that, they hire and train your social workers. They have like online and in-person training services. So but one employing those social workers under your license, because Medicaid is paying you directly then. When you start off, they have a licensed practitioner. So all the social workers have to then meet with the licensed practitioner, and then they review the notes, and that's what all goes to Medicaid. They provide that at first. As you grow, then they're going to expect you to take on your own licensed practitioner and pay for that as well. But they'll hire them and train them for you. You're the one getting accredited with Medicaid. You pay the royalties to them. The way it works, though, because the work is done in the communities, out in the schools and the homes. Like, for us, the office side of it, we're using like Aegis and WeWorks, like those office share spaces. We only need a little room with a desk, and it's like $500 a month. That's your whole expense on the office side, so really low expense. These also, the social workers we're bringing on are 1099, so they only get paid when they work. So they meet the kid, submit their notes. Medicaid pays like 14 days later, then you pay them. So it's paid in arrears. So they're getting paid on the back end. So you're not having to cover their work on the front end. About the mostly passive, it is your business. There's going to be some high level management that needs to be done, like accounting, things like that. So you can hire that out. And there's going to be an office admin that's actually going to do your billing for you, does your payroll and all that. They hire them too and help you with that. So it's going to be high level.
Okay.
If you want something that's fully 100% passive, we are offering a share model where we're buying our clinics and we're offering a 10K share into that clinic. That gives you 7% of the net revenue. At 30 kids, that should equate to about $13.50 a month. But again, that can go to 60 kids, 90 kids. That could double and triple. We're also offering on the back end, if 3 years down the road we decide we want to sell one of these things, now you've got a cash flowing, mostly passive clinic in the medical field, medical, whatever. Like, you could sell that on the business for 3, 6, whatever times your EBITDA or whatever. We're also going to pay out on the back end on the shares, 7% of that net gain goes to the shareholder as well. So so even for the shareholders, it's 100% fully passive that way, with a nice cash monthly and then a payday potential on the back end too. The reason we're doing that is, like, we're selling these shares, but we're retaining 51% ownership of each clinic. So really, we're using all that money to help fund us to buy more clinics. We'll put together all this management side of it and all that, and then we just offer this payout to everyone who came along for the ride, I guess, kind of to help us grow it and get it bigger. So we're on our 6th clinic right now. We'll probably be opening our 7th one here probably in the next week or two. We know them through a connection of it was another trucking partner that we had who actually is friends with Andrew. If you see in the videos, what he's done is he's a business development guy. He's taken businesses from start to exit. And that's kind of his side. He knew Charlie and Arian, who were the clinicians running their clinic, got to know each other. He's like, what are you guys doing? How are you making all this money? They showed him the P&Ls. He's like, these things look amazing. I think there's something here we should look at. And they came up with this franchise model. His goal is to take this to exit, and they're supporting it. So they've been building out an awesome team, a corporate team in Houston. They're opening up corporate in Dallas. They're going to be in like San Antonio, Austin. They're opening up in all the cities. Another play here too is as they have, hundreds of these clinics, then they add like, say, substance abuse. They'll be like overnight one of the largest substance abuse providers in the state overnight. So there's opportunities like that that'll come down the road. Another side of it is they're building along the border too. They're putting up clinics. When these illegals come across, a lot of them give themselves up for political asylum. They have to get a mental health screening and they have to do a drug test. So they can buy these cups for like $1 or something. They can sell them for $12 to $13. The government reimburses them. So they make 12, 13x on these cups. Plus they can do the mental assessment on them too as well. So like that's another business model they're opening up along the border towns too. So that's another thing that they're doing. But the kids is the big play. I mean, you're helping kids, we're creating jobs. There's a good money to be made with the investor too. It's like a win-win-win across the board, really. They kept it really simple. They use like only a couple little codes, and it's really like they're not giving out narcotics. They're not diagnosing. They're just like really literally just being like big brother, big sister program with these kids and just hanging out with them, teaching them life skills. Because the state of Texas, you want to get them to become a tax producing citizen, like, right, just graduate high school, go to college, tech school, military, whatever. The other side, they go in a gang, they end up paying, they end up in jail, and they're cost the state 80 grand a year for an inmate, and they're seeing the value of having this program as preventative. Texas, you've got oil and they've got really high property taxes. That's what funds this. They don't take any extra money from national Medicaid. It's all state funded. So this has been around for decades. It started like in the 90s. It's been in 90s, it's been moved up to $102. So it's like not going anywhere. It's been around forever. They are opening all these clinics, but there's only a handful that are open, because here's the downside of the whole program is that to get Medicaid accredited, it takes 6 to 9 months. Yeah. So that's the downside. They just hired a woman, just came into corporate, like she's full-time in corporate as of last week. She's done like 20 years plus of just Medicaid accreditations, and now she's working in-house. They brought her in her salary. So they're doing all these things to make sure that they can streamline that process as quickly as possible, but it's going to take time. So we're waiting on hopefully new else from new clinics opening anytime. They've been opening. We're just waiting for them to do all their billing and get the P&Ls to come in. So hopefully over the next like 4 to 6 weeks, we'll see some new P&Ls coming in. But you're kind of taking a flyer on it right now, because the model's there, it's sound, they're just proving it out, but they're going to start raising the price. So on October 1st, the price goes to $75K, and on January 1st, it goes to $90K. Their attorneys are telling them they should be charging like $200K for this thing because of how much money can be made. So once they start proving that out with more and more clinics and P&Ls, that the price is going to keep going up. It's